Swelling is a relatively common side effect after tooth extraction, but if you follow your dentist's care instructions, you can keep it to a minimum. Let's take a look at how to manage swelling after tooth extraction. Tooth extractions should always be a last resort and not the first course of action. However, sometimes it is not possible to save a tooth and it needs to be extracted. While you won't necessarily swell up like a chipmunk, some swelling may occur. Some other side effects include slight bleeding, mild pain, or discomfort. Your tooth socket needs to go through a period of healing after tooth extraction, and the first phase is known as the inflammatory phase. During the inflammatory phase, the blood clot needs to form in the socket, and granulation tissue must form over the wound. You can expect some swelling to occur up to 4 days after your tooth extraction before the growth of new tissue can replace the blood clot. By the 5th day, the swelling should have subsided naturally, but it may take up to 2 weeks for it to disappear completely. The good news is that there are measures you can take to minimize swelling and speed up recovery and healing. Patients respond differently to tooth extractions. Some patients experience greater swelling than others, so you may need to try a combination of tips in order to get relief. Gentle rinsing with warm saline solution is recommended for the first 24 hours after tooth extraction. Do not brush the areas as you could dislodge the blood clot. Keeping the site clean may help with swelling and inflammation. Get lots of rest, but make sure you keep your head elevated so that the blood doesn't pool in your head, as this contributes to swelling. Use cold and warm compresses to ease the swelling. Ideally cold. Make sure you do not place a compress directly against your gum, but rather hold it on the outside of your jaw and neck. Eat on the other side of your mouth for the first week after your tooth extraction. Not only will your mouth be sensitive, but eating and drinking could also dislodge the blood clot. Use any medication prescribed by your dentist. Sometimes it is necessary. For more tips on managing extractions, please contact our dental care. Have a great day. Bye!